This is a series of podcasts sharing personal experiences of chronic pain. My name is Barry Jones. My co-presenter and medical expert is Janet Still, a family nurse practitioner. Both of us have lived with chronic pain for many years. There is presently 1.5 billion people living with this condition worldwide. This being a conservative number, that works out to be 1 in 7 people. An interesting question to the health profession, researchers would be, have the numbers of chronic pain increased rapidly enough to classify it as an epidemic and or a pandemic? We join Janet discussing some of these alarming statistics.
There's simple, straightforward answers to that question. The simplest one is that an epidemic and a pandemic has to be, it's actually almost like a legal classification. And in, for example, the United States of America, the CDC declares that, but internationally, the WHO, the World Health Organization, declares pandemics and epidemics. The reason for why they've not officially done that, although it could be argued that a number of different organizations have classified it as an epidemic, but the reason is that it's not an infection, but it is definitely a condition. However, the reason we're not hearing about it so much in the news, as well as the answer to your question, why would it not be classified as an epidemic, is because, for example, the media likes to have great answers or a story to share. Not that they wouldn't want to have a story about something really bad that's happened to someone with chronic pain, but there's no solutions. And generally, the problem is not solved. And that's the bottom line. That's the short and simple answer to your question.
How does the medical profession acknowledge these alarming numbers? Or is it just so much money invested in surgical procedures that things are quietly brushed under the rug?
No, it's not about that there's a cover-up, or at least not a purposeful cover-up, maybe an unintentional one. There's no cohesiveness regarding what is well, we're actually starting to get some cohesiveness now because people like myself have gotten very interested, various research scientists, many clinicians, because of the problem, the pervasiveness of the problem, and there's no cohesive or comprehensive care plan for chronic pain. There's no plan to prevent it. There's no plan to treat it. There's only just now starting to be definitions for what chronic pain is. And because chronic pain, there's many different kinds of chronic pain, that's also not an easy thing to do. But the process has begun. So it's not a cover-up that doctors don't necessarily talk about it, is that as busy as they are and as much as they're responsible for knowing about and treating a patient, until there's something that's been handed to them, this is it, this is what we do, the only thing they truly can do is refer you to a pain specialist. And they don't necessarily, they're not always moved to do that because they want to heal you. And so they try to do things to address it from various angles and fix the problem. So sometimes it's beginning to be talked about now in the chronic pain treatment groups that actually is part of the problem, not just that it's not getting addressed properly, but also that putting off treatment of chronic pain actually worsens the condition. And so this ignorance, basically, and I don't mean that in a negative way, I just mean ignorance, not having information, not having a game plan for treatment, is actually continuing the problem and making it worse. So they're not hiding it, there's just no comprehensive plan.
We both listened to a presentation from a Dr. Katz from York University in Canada. You can find that on YouTube. Just type in chronic pain after surgery, Dr. Katz. It should pop up. That's K-A-T-Z or Z. It highlights the reoccurring incidence of chronic pain after surgery. And in something as simple as a hernia surgery, there is a 22.5 occurrence of chronic pain that is accumulative. The numbers are quite alarming, and I would really suggest listening to the presentation to get a clearer grasp of what is happening.
That's correct. For the listener, when Barry's talking about a cumulative, he doesn't mean new cases. He means the cases of chronic pain do not go away. That's the definition of chronic pain. It continues. So you have your cases of chronic pain for the year, let's say 2005. By 2010, each year you've got new cases of chronic pain. So now those initial 2005 cases were not resolved. And consequently, we've got a huge number. And that's why when you look at the statistics of how many people are suffering with chronic pain compared to how many are suffering with cancer, which people think of as a huge problem, or with diabetes, which the news I think is making clear is a giant problem, or with cardiac disease, which is known as a killer. The interesting thing is that how many cases are of chronic pain compared to these? Well, all of those cases of those three conditions, those three big conditions I just shared, do not add up. They're about 50, maybe 60% of the numbers of chronic pain cases right now.
Yes, I think the recent statistics from the CDC show that there are 29 million suffering from diabetes, 26.6 million from heart disease, and 21 million from cancer.
That's right, and those are the most recent statistics. There'll be some more update, probably this from at the end of 2015. We'll see what the numbers are then, but as you can see, those numbers are significantly smaller compared to, I believe it kind of depends on who's counting and which countries and so on, but I think just in the United States alone, it's considered to be between 116 million to 130 million cases of chronic pain as of 2012, I think it is, if I'm remembering correctly.
Is there a research group or some professional organization that collates statistics of chronic pain?
There, just now, in the last year, they created a panel, an intergovernmental panel in the United States to address the creation of a comprehensive plan for chronic pain. So they even asked loads of clinicians. I got an offer to answer survey questions and to input information about my ideas of what needs to be done. Even actual chronic pain patients were included in that survey. And then they put out an answer. Let's see, I believe that was last year, 2014. So the answers, what they came up with, what the panel came up with, were in spring 2015. And of course, they didn't please a lot of people with what they came up. My own feeling is that it's always a work in progress, and when you're talking about a government coming up with a plan, there's only so much they can do. And honestly, what has been more productive has been when various research institutes put their resources together and create comprehensive research to get conclusions of the studies so that we can look at that as groups, as scholars, and create our own plans based on knowledge. So that was supposed to be, and I'm sure very much was taken into account. But again, government coming up with comprehensive plan, while being a beautiful idea, is not always necessarily the most perfect answer, but it's a start.